Welcome to our comprehensive guide on child therapy. In this video, we'll explore what child therapy is, why it matters, and how it can make a positive difference in a child's life. Child therapy is a specialized field focused on helping children navigate emotional, behavioral, and psychological challenges. Whether a child is struggling with anxiety, trauma, or family changes, therapy provides a safe space for them to express themselves and learn coping skills. Let's begin by understanding the basics and setting the stage for a deeper dive into this important topic. Children, just like adults, can face emotional and psychological difficulties. Sometimes, these challenges are too complex for them to handle alone. Child therapy offers professional support, helping children process their feelings and experiences in a healthy way. Early intervention can prevent issues from escalating and promote long-term well-being. In this scene, we'll discuss common reasons children might need therapy, such as anxiety, depression, trauma, or behavioral problems, and why seeking help early is so important. Recognizing when a child might benefit from therapy is crucial. Some common signs include sudden changes in behavior, withdrawal from friends or family, frequent mood swings, or trouble at school. Parents and caregivers should also watch for physical symptoms like headaches or stomachaches without a clear cause. If a child expresses feelings of sadness, worry, or anger that persist, it may be time to seek professional support. Understanding these signs can help families take timely action. Child therapy isn't one size fits all. There are various approaches tailored to different needs. Some common types include play therapy, cognitive behavioral therapy, CBT, art therapy, and family therapy. Each method uses unique techniques to help children express themselves and work through challenges. For example, play therapy uses toys and games to facilitate communication, while CBT focuses on changing negative thought patterns. The right approach depends on the child's age, personality, and specific concerns. Play therapy is one of the most widely used forms of child therapy. It allows children to express their thoughts and feelings through play, which is their natural language. Therapists use toys, games, and creative activities to help children communicate in a way that feels safe and comfortable. This approach is especially effective for younger children who may not have the words to describe their emotions. Through play, children can process difficult experiences and develop problem-solving skills. Cognitive behavioral therapy, or CBT, is another common approach in child therapy. CBT helps children identify and change negative thought patterns that affect their feelings and behaviors. Through structured sessions, therapists teach coping strategies, relaxation techniques, and ways to handle stress. CBT is particularly effective for anxiety, depression, and behavioral issues. By learning to reframe their thoughts, children gain confidence and resilience. Art therapy uses creative activities like drawing, painting, and sculpting to help children express emotions they might not be able to put into words. This approach is especially helpful for children who have experienced trauma or have difficulty communicating verbally. Art therapy provides a non-threatening outlet for self-expression and can reveal underlying issues that need attention. Therapists guide children through creative projects, encouraging them to explore their feelings in a safe environment. Family therapy involves working with the child and their family members together. This approach recognizes that a child's environment and relationships play a significant role in their well-being. Family therapy sessions focus on improving communication, resolving conflicts, and building stronger connections. By involving parents and siblings, therapists can address issues that affect the whole family, leading to more lasting and meaningful change. Child therapist is a trained professional who creates a safe, supportive environment for children. Their role is to listen without judgment, guide the child through challenges, and teach coping skills. Therapists use age-appropriate techniques and adapt their approach to each child's unique needs. Building trust is essential, as it allows children to open up and engage in the therapeutic process. The therapist also works closely with parents to ensure consistent support at home. Typical child therapy session is structured yet flexible, allowing the child to feel comfortable and in control. Sessions may include talking, playing, drawing, or other activities, depending on the child's age and preferences. The therapist observes and interacts, gently guiding the child to explore their feelings and experiences. Sessions are confidential, and the therapist keeps parents informed about progress while respecting the child's privacy. Parents play a vital role in the success of child therapy. Therapists often involve parents in the process, offering guidance on how to support their child at home. This might include learning new communication skills, setting routines, or practicing coping strategies together. Parental involvement ensures that the child receives consistent support and reinforcement, both in and out of therapy sessions. Establishing trust is a cornerstone of effective child therapy. Children need to feel safe and understood before they can open up about their feelings. Therapists use patience, empathy, and consistency to build this trust. They respect the child's pace and encourage honest communication. Over time, this trusting relationship becomes the foundation for meaningful progress and healing. Confidentiality is essential in child therapy. Children need to know that what they share with their therapist is private, within certain limits. This assurance helps them feel secure and willing to talk openly. Therapists explain confidentiality in age-appropriate ways and involve parents when necessary, especially if there are safety concerns. Respecting privacy builds trust and supports the therapeutic process. Goal setting is an important part of child therapy. Therapists work with the child and their family to identify specific areas for improvement, such as managing anxiety, improving social skills, or coping with loss. Clear goals provide direction and help measure progress. These goals are flexible and can be adjusted as the child grows and their needs change. Tracking progress is crucial in therapy. Therapists use various tools and observations to assess how the child is doing over time. This might include regular check-ins, feedback from parents and teachers, or self-assessment activities for older children. Celebrating small victories helps build confidence and keeps the child motivated. Progress isn't always linear, but every step forward counts. Child therapy can present unique challenges. Some children may be reluctant to participate or have difficulty expressing their feelings. Cultural differences, family dynamics, and external stressors can also impact progress. Therapists are trained to navigate these challenges with sensitivity and creativity, adapting their approach as needed to support each child's unique situation. Early intervention in child therapy can make a significant difference. Addressing emotional or behavioral issues early helps prevent more serious problems later on. Children learn healthy coping skills, improve relationships, and build resilience. Early support also benefits families, creating a more positive and supportive home environment. The sooner help is provided, the better the outcomes for everyone involved. Finding the right therapist is an important step. Start by asking for recommendations from your child's doctor, school counselor, or trusted friends. Look for licensed professionals with experience in child therapy. It's important to find someone your child feels comfortable with. Don't hesitate to ask questions about their approach, experience, and how they involve families in the process. Therapy is most effective when supported at home. Parents can help by maintaining open communication, creating routines, and encouraging healthy habits. Show empathy and patience and reinforce the coping skills learned in therapy. Celebrate progress, no matter how small, and provide a safe, loving environment where your child feels valued and understood. Sometimes a child may need more intensive support, such as specialized therapy or medical intervention. If you notice persistent or worsening symptoms, or if your child is at risk of harming themselves or others, seek immediate help from a mental health professional. Early action can make a critical difference in your child's safety and well-being. Child therapy is a powerful tool for supporting young minds. By recognizing the signs, seeking help early, and staying involved, parents and caregivers can make a lasting positive impact. Remember, every child is unique and progress takes time. With patience, understanding, and professional support, children can overcome challenges and thrive. Thank you for joining us on this journey to better understand and support child therapy.